Thank you, Chris. Yes, my name is Nancy Corser, and I work with my husband, Ron Corser. You'll hear a little bit more about who he is and our organization. But today we are going to focus strictly on the upcoming Medicare open enrollment with an emphasis on critical need-to-know information. It is an educational seminar, meaning that I'm not going to talk about any plan or product or insurance company specific. Know that I am an independent agent, meaning that I do have access to all the different carriers. So no plan specific information today. It will all be announced on October the 1st. It will all be available on Medicare.gov, and you will also have access to that information. But until then, I've got to keep it very general and very generic. Here's a picture of our team. In fact, it's a brand new picture. And you can see myself standing next to my husband, Ron. We've been married for about 30 years. And to the right with the gal in the stripe is actually my sister. She's been helping us out for the last couple of years. And to her right, which I think is still your right, is Nolan, and he's the other advisor. So we've got two financial advisors. And the rest of the folks are the staff, along with Lauren, who's my assistant or client services manager for all of the healthcare side of the business. And she is the one helping me with the technology. So we have hired a young person who can help with all the technology because I'm in a little older arena. So here we go. A little more about me. I've been in the business for 15 years. This is what I specialize in. This is my baby. I consider myself an expert with Medicare. I've got a lot of contacts at Social Security as well as Medicare. So my focus is going to be on helping people with their Medicare Advantage plans, their Medigap plans, and their Part D prescription drug plans. We do connect the health and the wealth, and it's a nice combination. When I started working with my husband, many of his clients kept saying, what am I going to do, Ron? I can't figure this Medicare thing out. It's so overwhelming. It's so confusing. And before you know it, I made that my specialty. And I'm going to turn my phone off here a minute. There we go. So as an organization, we are independent. And one thing to keep in mind is I am very relationship oriented, meaning that I'm not a one and done. I will stay in contact with you as much as you would like, but certainly during open enrollment, and that's what we're going to spend some time on this afternoon, how important it is to make sure you review your plan, either on your own, because you're going to get a lot of material from the insurance company that you currently have, or by giving us a call, and we would be happy to guide you through that review process, because it's all about changes that the plans may make and you being aware of what they may look like and how it's going to impact you. A little bit there about Lauren. She's newer to our team. She has a background in property and casualty, so she's familiar with insurance, but just a little different side of things. She was very excited about coming aboard and learning all about Medicare. And she has a very strong customer service background in terms of following up and getting you the information that you need, helping schedule appointments for me, so on and so forth. Medicare has 3 different enrollment periods. When you first come aboard, and the assumption here is that most of the folks that are on this call are already in Medicare. Know that if you're not yet signed up and you're turning 65 in the next couple of years, you're welcome to stay on the call, but what you're going to focus in on will be your IEP, and we can certainly help you with that at that time. So your IEP is when you first come aboard or when you're first eligible. Your SEP is referred to as a special enrollment period, and that typically applies to somebody that has lost their group coverage and they're coming aboard and they're older than 65. Or it could be someone already on Medicare that says, I'm moving from Florida to Michigan or Michigan to Arizona, and they might have a plan that will not allow them to stay in that plan because they now have a new address or they have new geography. And then we have the AEP, and again, that's the focus today, the annual enrollment period or annual election period or open enrollment. Those are three names that you'll often see advertised over the next couple of months, AEP or OEP, and they're one and the same, and it's telling you that you have a 7-week window that starts on October 15th and it goes through December the 7th, and that's the time to make a change if you want to make a change. And that change then is effective on January 1st of the subsequent year. So once a year you can make changes, and we're going to primarily be talking about changes then that can be made to Part C, which is the Medicare Advantage Plan, or Part D, which is the prescription drug plan. Those are the two plan letters, or parts I should say. Call it a part, Nance, it's not a plan. Those are the two parts of Medicare that can be changed, and they are overseen by Medicare and Medicaid. That's the governing organization. Every one of you on Medicare today will receive an annual notice of change, whether it's for your Medicare Advantage plan or whether it's for your Part D prescription drug plan. They have to be delivered to you no later than October 1st, so please be on the lookout for that. Some plans do a little better job than others of making you aware of the changes, so you might have to dig a little bit. Certainly you can uncover what the premium is, but you need to cover what happened to the deductible, what happens to the copay, what happens to the coinsurance, because those are all possibilities for changes. And the key here is you don't want to leave your plans on autopilot. Work with a professional like myself, or if you do have a Medicare advisor or agent, call on them during this important time of the year to help you. A lot of people are confused about Medicare in general, so we're going to do just a very brief review about the parts and pieces, and then again really focus on what you can do and what you should look for during this 7-week period of time. So during this time you can change from one Medicare Advantage plan from one carrier to another. What does that mean? It means you could change from a Priority Health to a Blue Cross, from a Blue Cross to an Aetna, from an Aetna to a WellCare. This year, there's probably 30 different plans and about 5 or 6 different insurance companies that have Advantage plans in the Western Michigan area. Or you might stay with the same company, but not know that they have 5 or 6 different plan choices. So they have a low plan, a medium plan, and a high-end plan. So that's when people might say, you know what, I need a plan that's going to give me some more coverage. Or it could be changing from one Part D prescription drug plan to another. And that typically applies to somebody who has a Medigap plan, meaning that the Part D is separate. It no longer is included in the Medigap plan. It was years ago, but it is a separate plan that you could change from WellCare to Humana, from Humana to SilverScript, from SilverScript to United Healthcare. The names go on and on. But again, in most cases, there's about 30 different choices for both the Part D as well as the Medicare Advantage plan. And it's important that you work with an expert, a professional who can help you make sure that you're in the right plan for next year. You can also disenroll from a Medicare Advantage plan. So I will have people that will come to me during the 7-week window and they'll say, I want more coverage. I've heard about the Medigap plan. I know it's more expensive, but I also know it gives me more coverage. I'm willing to pay more for it. I like the idea of being able to pick my own doctor instead of having to stay in a network. Those folks will come and apply for a Medigap, and then we will cancel their Medicare Advantage plan at the end of the year. And those plans do have to be medically underwritten, and we'll speak a little bit about that in a moment. Or we could have somebody who says, I don't want to be in an Advantage plan or a Medigap plan. I want to return to just original Medicare, which is referred to as Part A and B. All they carry in their wallet or their purse is strictly the red, white, and blue card. Then they add a prescription drug plan to it, and they call it good for the next year. They don't have any added coverage. They work with Medicare and its offerings. Or we sometimes have somebody who's either failed to add a Part D prescription drug plan. Maybe they were a veteran and they had veterans coverage through the VA, but they feel that the prescription commercially offered drug plan might be better for them. Again, that is the time of the year to do that. So an overview, we're talking about A, B, C, D, all those different letters of the alphabet. We're going to talk a little bit about costs and coverage. We're going to talk about critical facts, meaning that you have one of two options when it comes to your supplemental. Because Medicare doesn't pay for everything, you are given an option to add to that. We'll talk about that. Some important need to know information and tools and resources that will be available to you. Chris also sent to you, and if you don't have it, you just let us know, but we did send to you an outline, and we sent some other material that I am going to be referring to throughout the presentation. So if for some reason you don't have it, do let us know and we'll get that to you. So Medicare is the government health insurance program that you worked for all those years. Those of you that are retired or maybe still working. You paid into Medicare Part A. You did not pay into Part B. There is a charge for that. It's been around since 1965. The president was Lyndon Baines Johnson, part of the Great Society. They wanted to make sure that people had health insurance when they retired. And back then, Social Security was available at age 65, so they went hand in hand. The program itself is administered by the Centers for Medicare and Medicaid. But today we're going to focus on Medicare, not Medicaid. Medicaid is a program available for people based on their lower income and other medical needs. So typically speaking, you have to be 65 or older. You have to be a legal resident of the United States. There are people under the age of 65 who qualify for Medicare, and that's because of a disability, where they've qualified for Social Security disability, and 25 months later they become eligible for Medicare. And people of any age that have kidney failure or end-stage renal disease are eligible for their Medicare. So the four parts, we have Part A and Part B, which many of us are familiar with. A is the hospitalization. There is no premium, but there's a lot of out-of-pocket expense associated with Part A, which points to the fact that most people say, I don't want to be on the hook for over $1,400 worth of a deductible, because that's where Part A starts. Part B, often you hear on TV or read that typically Medicare covers 80% and you pay the 20%. So that is the medical services received outside the hospital. So it's going to the doctor, going to a specialist, an ambulance ride, physical therapy, an MRI, CAT scan, those types of things. When you're admitted to the hospital, and that's the key, you want to be admitted, everything is billed under Part A, and that's where that deductible comes into play. Part B, billed at 80% versus 20%, they're going to send you a bill for the 20%. So we're really just stating Part A and Part B. We're not talking about supplemental yet, just strictly if all I had was my red, white, and blue card, I'd get A and B, and that's basically how that would work. Now there's one other deductible associated with Part B, and it's $198. And that is for a medical service that would be received. Keep in mind, all of Medicare starts with a calendar year in January, goes through December, and every year, typically, the numbers have changed. So the Part B premium currently is $144.60. That's the base premium. I have heard it won't go up next year, but I have not had it confirmed. Nor have I had confirmed any of the numbers associated with Part A. Because as I said, Part A does have a deductible of over $1,400. And I don't know if it's going to go up for next year given COVID-19 and the impact there. So more to come on that. When you do sign up for Part A and Part B, the expectation is you do sign up for Part D. And Part D is the prescription drug plan. More to come on that. And then Part C is a plan that's been around for probably 17 or 18 years now. And it is managed care through an insurance company, one-stop shopping. And the government oversees Part C and government oversees Part D. And that's what's eligible for making a change on. Part C and Part D. There is no Part E, F, and G yet, but maybe at some point there will be, but not yet. So what Medicare doesn't cover, just to kind of remind you here, they don't cover any custodial or long-term care, which is typically after 100 days. They don't cover care outside the United States. Doesn't mean that some of the plans don't, but as a general rule, Medicare original Part A and Part B, strictly care in the United States, not Mexico, not the Canada, so on and so forth. Generally speaking, they do not include dental, vision, and hearing. No cosmetic surgery, so no facelifts for anybody. Acupuncture and other alternative care. They are bringing on some type of acupuncture in 2021. I'm waiting to get more details, but they have said we're going to look at some alternative care in any amounts that are over Medicare, above and beyond, that are not approved. So when you come aboard for with Medicare, you always have to know that, is it medically necessary? And is it a Medicare eligible expense? So you always start with that framework first. And I encourage you, for those that have worked with your doctors and specialists and so on, they got to, one, know that you're in Medicare, and two, hopefully they're advocating for you and saying, yes, this is a Medicare eligible expense. And if it's not, they're making you aware of that. Because if it's not, and your supplemental plan doesn't come to the table to pick it up, you're going to be responsible for that expense. So it is kind of, let's work together. Let's make sure we know what the rules of Medicare are, who's going to pay, is it covered, so on and so forth. So here's my Part A. I said you were paying into it, so therefore there was no premium charged to you. And even if you continue to work and you are on Medicare, you still pay for Part A. As long as you're working, you get a payroll check. They're going to take a Medicare component out. So Medicare Part A is full of deductibles and co-insurance. It covers your hospital and any skilled nursing and hospice care. Part B has a base premium. If you're married, it's less than about $178,000. They look at your joint income. They look 2 years back when they assess your Part B premium. For most of us, it's $144.60. If anyone is what we call a higher income beneficiary, I'd be happy to share those numbers with you. But the good news, bad news is you get to pay more than $144.60 for your Part B, and you also get to pay more for your Part D. So being a higher income beneficiary tags you with two, both Part B and Part D, above and beyond what we have here. Part B is, again, that 80-20 kind of combination. It covers your doctor's fees, outpatient hospital visits, and also includes all your preventative services like colonoscopies, mammograms, and so on. That's original Medicare. This is just a bit of a diagram. We took it out of the Medicare and You book. Most of you, again, if you're on Medicare, I encourage you to use your Medicare and You book. This was my 2020. Actually, it's my husband's book, but I borrow it every year. And what just happened here? Let's go back. There we go. So what this begins to tell you is we're going to paint the picture of what I refer to as the left side and the right side. So if you came to see me, and you're all welcome to come and see me with a mask, because we've been meeting with people since June, or we can do a telephone interview or a telephone appointment, or we can do a video conferencing like a Zoom or Ring Central and so on. But this diagram is helpful just to kind of put in your mind, where am I and where do things fit? So it works this way. Everybody has to be in Part A and B. It doesn't matter what kind of supplemental plan you have. Everybody pays in Part A and Part B unless you're on Medicaid, but we're talking about Medicare here. So First enrollment, Part A and Part B. Pay a premium, have a lot of out-of-pocket potential expense. If you're on the left side, what you've said is, I'm going to keep my red, white, and blue card. I'm going to put it in my wallet for safekeeping. Then I'm going to add a Medigap supplement, which would be the supplemental coverage at the bottom of the page, which we'll talk about as well. And then you would add a Part D. So the person on the left has 3 cards in their wallet or their purse. They have their red, white, and blue card. They have a Medigap plan. It could be with carriers like Transamerica, Mutual of Omaha, AARP, Priority Health, Blue Cross. There's probably about 35 different Medigap carriers in our area. Then you also add a prescription drug plan, because if you don't, you pay a penalty by not signing up for it. And the Part D, again, is what we talked about in terms of looking at renewing on an annual basis. And if your meds change, that's something you want to definitely evaluate. The person on the left, they have said, I'm willing to pay more in a premium. I like the idea of being able to pick the doctor I want to pick as long as they take Medicare. And they can travel anywhere in the United States, all 50 United States, and they virtually have no copay. So unlike the deductible for the hospital of $1,400, this Medigap plan that they select is going to pick all of the $1,400 up. So they're paying more, but they're getting more. So it's very flexible. Primary insurance here is Medicare. Secondary insurance is your Medigap plan. And then you add a prescription drug plan to fulfill your medication needs. On the right-hand side is the Medicare Advantage Plan, very popular. Some of the premiums are as low as $0, very attractive. Everything has a copay. So when you go to the doctor, you might pay $5 or $10. If you go to a specialist, you might pay $35 or $40. If you go to the hospital, you might pay between $250 to $350 a night. The key to keep in mind for the Advantage Plan is your doctors and medical professionals must be in the network, because when you operate outside of the network, you are subject to paying more. So part of our service is always making sure that your plan includes the doctors, hospitals, labs that you want. If you're willing to make a change, then that opens it up for other possibilities. But if there are doctors you want to continue to see, then we want to make sure that they continue to be in the network. Part D, typically, probably 98% of the time is embedded into the plan, because what you have here is one-stop shopping. It's one card. So you can put away literally your red, white, and blue Medicare card. You might need to use it the first time you go see the doctor, because they are going to take those unique 11 digits off of your card. Everybody by now should have a brand new Medicare card. It's got the 11 digits alphanumeric on it. That's what they want to see typically the first time. But beyond that, you would have a card from a Priority Health or a Blue Cross or Humana or Aetna and so on. And it's pretty much one-stop shopping. You go to the pharmacy with your card. You have dental benefits with your card. You're able to go to a health club with your card, so on and so forth. So that's what you're using. Now, the Advantage Plan companies are responsible for managing your care, okay? So sometimes there's a few more, not loopholes, but a few more jumping of the hoops, if you will, because you're going to have to work with their guidelines, which are dictated by Medicare. And if they require prior authorizations and restrictions and so on and so forth, sometimes you just got to make sure that you understand that there might be a little bit more, that you just got to ask a few more questions to make sure that there are no surprises. So in an Advantage Plan, it has copays and coinsurance and so on and so forth. So if you ever get a bill that doesn't seem to sink in with the plan design, it's definitely worthy of a phone call and saying, okay, I got a bill. I'm not exactly sure what's this for. Would you please walk me through it? My mother has the Medicare Advantage Plan. And every once in a while, we'll get something and it's like, Mom, I'm not sure. You were in the hospital, but what does this mean? It appears to be something above and beyond what the plan has actually told us about the hospital stay. So don't be afraid to bring it to either the insurance company's attention or call your agent and say, hey, I don't understand how this part's working. So again, one-stop shopping, prescription drug coverage built in, got all these extra benefits. A newer benefit in the last year also has been over the counter. So many of the plans allow you to order products either online, or you can go into a Walmart or a CVS. You're given an allotment on a quarter by quarter basis to spend, and you can go in and buy vitamins and Band-Aids and Pepto-Bismol and so on and so forth. So a nice benefit. Biggest mistake that we see people do during this time is doing nothing. So we're just really encouraging you to look for that summary of benefits, make a point of going through it, as well as giving us a call. So here's some critical facts about one of the supplemental plans. So for any of you that might have a Medigap plan, if you have seen the premium rise over time and you are still pretty healthy, it might be time to revisit your Medigap plan. So what I want you to know is you can do that at any time of the year. You don't have to do it during open enrollment or the annual election period. And some people think that is when they can only do it. That's not true. You can do it any time of the year. The key is going to be, once you've been in Medicare, the next time you look at making a plan change here with a Medigap or coming from an Advantage plan to a Medigap, you have to be able to answer the medical questions. So there is no medical exam. They don't request your medical records, but we fill out the paperwork together. And if there are questions that you can't answer no, then we call the insurance company and we say, this is what's going on. I had yesterday a person who had 3 high blood pressure meds. I said, you know, I think we need to check. Even though you say it's well managed, we need to make sure that you're still a candidate. And they said yes, as long as he didn't have diabetes, which he did not. So that's part of our service, is to walk you through the questions. Then if it's a go, we have you fill out the enrollment or the application. And then if you're approved, because they will call you on the phone and they'll just double check all the medical information with you, then you're eligible to cancel the old and begin with the new. And yesterday, the revisit with this individual resulted in a $500 a year savings. So he obviously said, let's go for it. I think I'm going to qualify. The Medigap Plan F, for anybody that has Plan F as in Frank, it's still in play. You can still keep it. Plan F has been eliminated for anybody that has a birth date of 1955 or later, or anybody that is still working and has not applied for Medicare Part A or B. And G is the next best plan. So today, for people that are age 65 and older, but born in 55, their best plan is Plan G. And the only out-of-pocket expense for Plan G is the Part B deductible, which is $198. Otherwise, we have other standardized plans, A through N, and if I was to show you the diagram, it would show you that there's more and more out-of-pocket expense with the other plan letters that are A, B, C, D, and so on. So when you look at what I call the matrix, and I would show you Plan G, the only out-of-pocket expense is the Part B deductible. Otherwise, it covers the 20% coinsurance for Part B. It covers all that hospital expense of $1,400 and some dollars, and anything else you and I can come up with. It would be added blood, it would be days 21 through 100 in the nursing home, so on and so forth. It virtually covers it all. Keep in mind, with the Medigap, there is no network. You're not working with an HMO, PPO, elemental P, so on and so forth. The key is, does your doctor take Medicare? That's the only question that you need an answer on. Once in a while, I'll hear people say, well, my doctor said they don't take Greek Catholic Union. And you're like, okay. But Greek Catholic Union may be a name you don't recognize, but they are a Medigap carrier. They've been authorized by Medicare to sell these plans. and your medical professional will have to set them up in their system, because if they participate with Medicare, they have to participate with all of the Medigap approved vendors. So once in a while, there'll be names that people don't recognize. Again, Greek Catholic Union is a good example. A lot of people recognize Blue Cross, they recognize Priority Health, so on and so forth. But keep in mind, carriers like Priority Health and Blue Cross and Humana, they have plans that are supplemental on both the left side and the right side. So they have a Medigap plan, going to pay more, get more, and you're going to have the Medicare Advantage Plan. You're going to have a lower premium, you're going to have out of pocket, but you're going to also have a lot of other value added services. So don't be fooled when somebody says, well, I don't pay anything for my plan. Well, they're telling you you're on a Medicare Advantage plan then. But if you were to ask them what they paid to go to the hospital, they might tell you that they paid several $100s. The person on the left side in the Medigap doesn't pay anything to go to the hospital. The coverage here is available in any state in the United States. So whether you're in Arizona or Florida, if you have a medical emergency, you're not going to pay anything. If you need to go to a dermatologist and you find somebody that will take you, you're not going to pay anything. There are no co-pays. There are no deductibles. The only out-of-pocket is that one-time Part B deductible. And all of these are guaranteed renewable. So what that means is once you're in, you're in. No matter what happens to your health, no matter how much money they spend on your care, they can never cancel you unless you don't pay your premium. You will have an increase on an annual basis. It's based on your age. The plans are written where they talk about attained age. So every year you attain a new age, and every year you're going to get a rate increase. And I have seen much larger rate increases over the last 2 years than ever before. And I think it's due to the rising cost of medical expenses, cost of living. It'll be interesting to see what COVID does in terms of going forward. But this is why I mentioned to you, if you're relatively healthy, it doesn't mean you can't change Medigap carriers. And that's exactly what happened yesterday. He went from carrier A to carrier B, and he saved $500 as a result of that. Now we're going to move on to the prescription drug plan. This is what must be paired with a Medigap plan, and there are certain things that are universal, meaning that regardless of whether you're an Advantage plan or not, it's going to apply both ways, on the left side and on the right side of that diagram. First, you must know that all the plans are required to cover substantial drugs in all the different categories. So whatever you can come up with as a medical malady, they've got to have coverage for it. Gout, vertigo, hypertension, diabetes, cancer, so on and so forth. It's the companies that will decide what particular medication they will put in their formulary. Most of the generics are universal and everybody puts them in there. The lisinopril, the simvastatin, so on and so forth. It's when you get into the brand names that sometimes you see some of the carriers not have that medication. So several years ago when Eliquis was introduced, not every Part D had Eliquis. Now they do today, but there also is no generic equivalent for Eliquis. So that points to why some people in particular who take a lot of meds and maybe have some new ones or take some brand name meds should really go back to the drawing board, and they should have somebody help them identify the best plan for them. So when we do that, we look at your medication mix, we look at the pharmacy that you go to, the frequency of when you take your medications, and then the website medicare.gov does a lot of the work for us, and we just guide you through it. We have a great big screen in our office, and we show you exactly what we're looking at and how we came up with the recommendation. So most plans change annually. Could be the premium go up, the premium goes up, premium once in a while goes down. Sometimes they introduce some new plan entrants as well. Next year, 2021, just for those of you that have Envision, they're going to change the name to Elixir. So don't be surprised if you get something in the mail from Elixir. It still is Envision. SilverScript's going to announce a new plan next year. So you'll hear more about that. It's a very low cost plan. And I tell you that because some people don't take any medications and they'll say, now, what do I do? And I'll say, let's put you in the least expensive plan. That way you avoid the penalty. And if you need any medications, they're going to be there for you. So I know that one's going to be introduced. There were some plans this year that were out there through, I'm trying to think of the name. It's not Blue Cross Blue Shield, but there were two small plans that were under the umbrella of, it was one of the blues, but it's not the Blue Cross. Right now it's escaping my memory, but those were also eliminated for next year. Anytime they eliminate a plan, they will notify you of the plan going away, and that will allow you an opening to certainly pick another plan. So every plan has a premium. Some of it's buried into the premium with the Medicare Advantage plan and you never see it. Certainly on the standalone plans that go with the Medigap, you're going to have a premium. This year, I think the lowest premium was $13.20 and it went right on up to $100 and some dollars. Most of the plans have an annual deductible. It changes every year. It doesn't mean you'll have to pay the deductible. It often is dependent upon what tier your medication falls into. And many times tier 3 and tier 4 and tier 5, which are the brand name medications, they often require that you pay a portion towards the annual deductible. And many plans have copays. So a copay, $2, $5, $10, $0. Keep in mind also that you have a retail pharmacy arrangement, and you also have mail order. Mail order generally is less expensive, but not always. And again, part of our analysis will show you what mail order is versus going into the retail. So these are the stages of the drug model. This was introduced in 2006. As I often say to a lot of people, if we only knew the people that put this into play and made them use this, chances are they have their own plan, because this was put in place by Congress and voted on and voted in. And it's really kind of confusing. So especially for those that are getting older and they got a bunch of medications and they're like, wow, I had no idea that, the next month I went in there, my premium or my copay went from $45 to $145. And then they find out that they were in what's called the Doughnut Hole. So basically what you have is this. Everybody starts in stage 1. You could be subject to that deductible depending upon your tier. Next year, it's going to be a $445 deductible. That's the retail price of the medication. So you might have only paid $10, but they might say on the outside of the bag, you saved $90 because the retail value is $100. So if you had a plan that had a $445 deductible that applied and your medication was a $100 retail cost, you just are going to pay the pharmacist $100. And the next time you go in, you'll have to see whether you have to pay anything more towards that deductible. But again, it typically applies to tier 3, which are brand name drugs and above. So then the government in the plan is going to keep track of all the monies that you spend at the pharmacy or through mail order. And they're going to send you a statement monthly, which you really do want to audit, because your number to audit is going to be the $4,130. That is where the donut hole begins. So it often will say right on your statement, you are $4,000 odd away from the coverage gap. They don't call it the donut hole. They call it the coverage gap. You are $2,000 away. So you can kind of gauge where you might find yourself in stage 3 and recognize that now you're going to pay 25% of cost. So again, my $100 example, retail price $100, copay $10. But if I'm in the coverage gap with that $100 drug, now I just paid $25 once I knew that I hit the $4,130. And that is the retail cost. So in this bucket, all the retail cost is what they're working with in stage 1, stage 2, and stage 3. We're going to keep track in stage 3 for you if you find yourself there. And then you could find very small percentage of the population could find themselves in catastrophic. And catastrophic is where you've spent over $6,500, and it's more than just your retail price that they take into consideration. Yeah. So more to come in reference to that. And again, if you want an analysis, it will show us, or I will show you on medicaregov.gov how to identify each stage along the way for you on a month-by-month basis. So here are some critical facts people sometimes are not aware of. We have immunotherapy drugs, treatments for cancer. They go through the Part B of Medicare, B as in baby, not D as in David. Somebody that's on a Medicare Advantage plan will have it go through the Part B. They will pay 20% of the cost of the chemotherapy, and all of that will go towards their maximum out of pocket. But chemo is pretty expensive, so if it was $1,000, and I think it's more than that, you would pay 20%. So for every treatment, that would cost you $200, but it all would go towards the maximum out of pocket. For those of you on a Medigap plan that could face a cancer type of treatment, again, where you're going in for the immunotherapy or I can't see all of this on here, but through the immunotherapy, you will not have to pay anything because that's all under Part B, and your plan's going to pick that up. So there is a penalty for not enrolling in Part D when you're first eligible. So we always encourage people, even if it's finding the lowest price plan, people that have veterans coverage through their Part D, that is considered credible. You do not have to purchase a separate Part D, and there is no penalty. And we pretty much talked about the coverage gap, with the exception a year or two ago, there was word on the street that the Doughnut Hole was going away. No, the only thing that happened to that Doughnut Hole is instead of paying 100% of the retail price when you hit the coverage gap, which is where it first started, every year the government took that percentage down where you were paying less and less and less, but it's not scheduled to go away. I mean, they may go back to Congress and try to eliminate it altogether. But at first, back in 2006, it was 100% of the retail cost. And then they ratcheted it down every year for the first, it probably went through 2018 or through 2019. But 25% is as low as it goes right now. Critical facts for Part D. Make sure that you don't pick the lowest premium just because you think, oh, that's the way to go. It might not be the way to go. You could have a $13.20 premium, but your selection of medications and where you want to purchase them, because there's such a thing as a preferred pharmacy and a non-preferred pharmacy, may result in you paying more than what you need to. Don't leave your plan on any kind of autopilot. That's just a reminder. Seek that professional guidance. Few critical facts about the Medicare Advantage plan. Keep in mind that it does include Part A, B, and D, but you do continue to pay for your Part B. That's often a question I hear from people. Oh, does that mean I don't pay for Part B because I have Plan C, or Part C, I should say, not plan, Part. Yes, you still pay for Part B. Benefits and cost sharing are going to vary from plan to plan. So you could have a low-end plan with a zero premium, or you could have a plan that offers a lot more coverage and you might pay $100 and some for that. Every plan has a maximum out of pocket. The government will say what the max will be, and then the plan will decide what they will pass on to you. So it could be $4,500, it could be $3,300, it could be $6,700. That can be an important element in your overall decision, because that's really your worst possible outcome. That's your catastrophic limit. Also keep in mind, because some people think coming off of a group plan that you have to satisfy the maximum out of pocket first for your plan to begin. That's not true. So if you had a $4,500 maximum out of pocket, you're good to go from $1. You go to the doctor, it's $15. They'll put that $15 in the bucket towards the $4,500. And if you ever hit $4,500 in my example, then the plan will pay all the co-pays and deductibles thereafter for the balance of the year. You still have a premium if you had a premium to pay, but no more deductibles, no more co-insurance if you hit the maximum. And again, they send you a statement every month and you should be monitoring that statement. Remember, these are private insurance companies and the plans change. We talked about the networks, the emergency and urgent care coverage. All the plans have worldwide coverage. You can go anywhere, Italy, Africa, so on and so forth. They're going to treat it as if you were here in Western Michigan. Most of the plans have the prescription drug plan. There's a few out there for people that have veterans coverage that I made reference to, and they don't need the Part D. We talked about the donut hole and the coverage gap. And a lot of the plans have the dental, the vision, and the hearing. Keep in mind it is strictly preventative, but most of them allow you to buy up. You can spend another $20 or $30, add it to your Advantage plan, and get a whole lot more services. Where you can get the root canal, you'll still pay 50% of it, but whereas the standard benefit that you don't pay for is pretty much kept to cleanings and x-rays. And we talked about the over-the-counter. The Shingrix shot, if you haven't had it, it is a tier 3, no matter whether you get it on the Advantage plan or you get it on the standalone plan. And if you haven't satisfied that annual deductible, it runs about $175 a shot, and you need 2 of them. We talked about the infusion and injectable drugs. They're going to go through the Part B, as in boy, of A and B Medicare. Make sure you revisit your Medigap plan if you'd like and you feel the premium has really risen and you might have an opportunity for a lower price premium. Same coverage. Stop contributions to an HSA. Anytime you enroll in Part A and B, you cannot continue to contribute to the HSA. You can use the HSA funds for medical expenses, but you cannot have an account anymore to contribute to. COVID-19, we've all been experiencing all the loveliness of this. Now we have the lab tests that are covered. The FDA authorized antibody tests are covered. There might be a copay associated with that. We'd have to check your plan. And know that if you ever were admitted to the hospital, it would be covered by Medicare, and it's going to be covered according to the hospitalization portion of your plan. So the Medigap person, they're not going to have any copay or deductible. The Medigap person is going to have that couple $100 deductible. We also have telehealth, which has become much bigger, again, as a result of the virus. So those services are available on all the plans. And then insulin. This is a biggie for people that are diabetics. They are going to be rolling out, I don't know if it's all the plans, but there's certainly going to be some plans, both on the Advantage plan side and the Part D side, where the insulin is going to be $35. And it's not going to end up in that donut hole and become $200 and $300. So more to come on that. We're coming in for landing here. Here are your tools and resources. If you haven't been out on Medicare.gov, it's a great website. The SSA.gov website is typically used for people that are enrolling in Medicare the very first time. That's the only reason I really mentioned it there, because more and more the government wants you to do things online. And we are here to help you with that. So again, contacts that we have schooled us in how to help people enroll in Medicare Part A and Part B, or people that are dropping their group coverage and coming aboard. We can help you with the forms that otherwise Social Security would help you with, and you don't have to make a phone call. We'll be happy to help with that part of it. MyMedicare.gov, you're going to get notification if you haven't already, and maybe some of you have already signed up. It is a place that houses all of your Medicare information, and in particular the Part D. So we're asking all of our clients to make sure they've set up this account so that we can help them analyze the Part D. Otherwise, I have to input them all manually. In this way, by having access with their help, it's a much easier process. Everybody gets the Medicare and You book. It comes out in October. There also is a Medigap policy booklet that you should have received if you're on Medigap, or if you want to see what that looks like. And then your carrier websites are a wonderful resource as well. And friends and relatives, but just keep in mind that you are unique, and your neighbor who might have one plan, it may not be the appropriate plan for you. But a lot of times you get some good insight into how things work. So our offer, and as Chris had said, I am not allowed to contact you directly. You must initiate either a phone call or an email. Medicare is very protective of you. They do not want you to be hounded, taken advantage of, somebody trying to sell you, as I would say, swampland in Florida, who knows what. You have got to say, we'd like some help, and then we'll make the arrangements for you to come into the office, talk on the phone, or do a presentation through Zoom or whatever the case may be. So we're very much about personalized attention and guidance. We see ourselves as educators. Yes, I get paid by the insurance company. If you decide you'd like our help and I become your agent, I will stay in contact with you. Every agent receives the same in commission. So there's no flipping from one company to another because an agent receives more by going to this company. The government got wind of that a long time ago and said, nope, this is what everybody gets. Here's our website. If you want us to do an analysis of your meds, that would be where you would send us. Or if you just want to send us an email that you'd like to make an appointment, that's one avenue. There's our phone number. Our phone system now is designed where option number 1 is for the financial advisor. Option number 2 is for the healthcare side of the business. So Lauren would most likely answer the phone, and otherwise I'll be answering the phone. And there are our email addresses as well. So we've tried to keep it any way you want to contact us that's easiest for you, okay? And that brings us to the end of our presentation. So if there are any questions, we're more than happy to answer them. Okay.
One of the slides said it referenced 2020 Medicare that you say comes in to come in October. Will this be 2021?
Yes, we are talking about 2021 guidance and coming in sometime after October the 15th, making an appointment. We're actually open for business on October 1st, so if that works out better for you, I'm fine with that, October 1st through the October 15th. The problem is I can't fill out any paperwork. I can give you enrollment forms, but we absolutely cannot send them to any of the insurance companies until after the 15th. But if you want to meet and get a better understanding of what's what, because we do have all the plan information after the 1st, but we cannot physically enroll anybody in anything brand new until after the 15th. And then I'll go back and fix that slide. Because we're strictly talking about 2021 plans, but being reviewed this year yet. Any other questions?
Hi, I have a question.
Okay.
My name is Cindy and my boyfriend Rich is here and he'll be 65 November 2nd.
Okay.
And, I'm a bit of a planner, so I'm kind of already in panic mode. So for the application process, would we have still time to set up an appointment with you, or should he apply as soon as possible and then have you review it?
Sure. So he's turning 65 in November?
Correct, November 2nd.
Is he on Social Security?
No.
Okay, so yes, you have time. And what I would recommend is calling, and we will help you get enrolled. We will help him get enrolled in Part A and B.
What about D?
And yep, we're going to help with all of that. But your first step is going to be to enroll in Medicare. What they give you is they give you a 7-month window to get enrolled. So November is his effective date. It will be effective the 1st of November, regardless of what day of November he was actually born.
Okay.
And August, September, and October are the 3 months before his birth month that he is allowed to get into his Social Security account. So he'll need to set up an account if he doesn't have one. And then you can enroll in Medicare off that same website. We can either do it over the phone, or you can come into the office and we will get you enrolled and we'll start talking about your supplemental options. But to answer your question, you have time because here we are in September, but I would recommend that you do it fairly soon so that you can get your card and be good to go. So give us a call. We'd be happy to help you.
Okay, so we'll see you tomorrow morning then. Is that what you said?
Yeah, you probably could if you needed to. I'd prefer next week, but if tomorrow's the only day, we'll do it.
Thank you, Nancy.
All right, we'll give you a call.
Okay, love to help. Okay, anybody else?
Are there any options based on income?
No, that's a good question. None of the options are based on income. The Medicare Advantage Plan isn't even based on your age or your sex or your weight or your height or your smoking or your non-smoking. The rate is the same regardless. So whether it's a 0 or a 10 or a 33, it doesn't matter. On the Medicare supplement or the Medigap side of things, it is strictly based on female versus male and your age, but nothing to do with income. Good question. Anybody else?
You had mentioned something about the health savings account, and so those can be used if you are at that age and have money in those to pay your premiums?
Well, you can use them only to pay your Medicare Advantage premium. You cannot use it to pay a Medigap premium.
Okay.
So the HSA accounts are, because the government kind of puts those guidelines together, they said you can use it to pay a Part C premium, you can use it to pay a Part D premium, and you can use it to pay any of the copays or deductibles that you might have on the Advantage Plan side. But you cannot use it to pay the $100 and some Medigap premium, no.
Okay.
Okay, anybody else? Was this helpful?
Yes,
Good, okay.
I have a question. I turn I turned 65 in May, so I'm still 64. But I
Okay,
just make sure I'm getting the information before I
absolutely.
have to do that. So when would I contact you? Because this is a lot of stuff.
It is. And I would tell you too, Martha, that I do teach a class through Community Ed, through Rockford Medicare Made Simple. And we have a class that starts next Tuesday. It's going to be all online. It's going to be a 2-part class. If you're interested, we can certainly get you signed up for that. But otherwise, to answer your question, I would recommend we get together after the first of the year.
Okay.
And then we'll walk you through the process. Typically, we say you want 3 to 4 months because you will be bombarded with tons of information. They start about a year beforehand in your mailbox, in your phone, and you want to be very careful about getting on a website and asking for information because they will absolutely come after you like you can't believe. So we would be more than happy to help you, but I think after the first of the year would be very adequate. So that would be fine.
Okay, because I turned 65 in May, and I'm already receiving Social Security.
So you're going to get your card. So that's a good point.
Okay.
You're going to want to be on the lookout for your card 3 months in advance. So start looking for that card in January, maybe February, but they're very prompt in getting you the card 3 months in advance if you're already collecting Social Security.
Okay,
And
great, thank you.
It's going to look like junk mail, so please make sure you don't throw it away. Yes.
All right, thank you so much. I will
You're very
contact you.
Sure. Thank you.
Nancy,
Yes.
I'm confused. I must not have been listening very well. At one point, there was that it would look back 2 years to determine the cost, but then just a few moments ago, it was that there was nothing that would affect your costs, like your weight or height or whatever. So can you tell me?
Sure. We're talking about a couple different things. So here's the language in reference to that. So the question initially that we talked about with Chris there had to do with the premiums for the supplemental plans. So it had to do with, was there any differential for the premium if I want an Advantage plan and I'm a millionaire? No. With Medigap, no. Now, what we're talking about that you're referring to is the Part B premium. So what you don't see in front of you that I'd be more than happy to share with you is that the government has a matrix that says if you make more than 100 and some thousand, I think 178 or something like that, and you file jointly, your premium is $144.60. If your income is more than that, then there's another increment. Let me grab my cheat sheet a minute here.
Thank you, Nancy.
Yep. And again, if you want, just give us a call or send me a quick email and I'll be happy to send this to you. But here it is. My memory's good, but there's a lot of numbers on here. So here's what I would tell you is every year the government looks at your Part B and says, what are we going to charge that person? And it is going to be based on looking at your income tax of 2 years prior. So the person coming aboard in 2020, they're looking at their 2018 income tax. And it's your modified adjusted gross income. So when they look at that and they say, are you married? And you say yes, they'll say, okay, is your joint return $174,000 or less? If your answer is yes, you pay $144.60. If your answer is I'm not married and I'm single, the threshold is $87,000. Now, if in 2018 you were working and you had a big bonus and you made $200,000 that year, joint income, I would tell you that you'd pay $202.40 for your Part B. And then you get to also add another $12.20 for your Part D. So all that is they're saying you're a higher income beneficiary. We're going to charge you more in the premiums that you are going to pay the government for your Medicare. And every year they're going to evaluate what your modified adjusted gross income is. So if in 2019 you retired and your income fell back to the first tier, the 174 for the married or the 87 for the single, then it will revert to whatever that tier is for that year.
Okay, very helpful. Thank you for taking the time to go over that.
Sure. And the only other thing I would say is sometimes people retire and because they look back 2 years, they're looking back at a year where they made big bucks. And they might have already done their income tax for the 1 year look back, and it might be in their favor. There is actually a government form. There's a lot of government forms, but it does allow you to appeal it and say, you know what? I know you're looking at 2018 and I made 200,000, but I've been retired since February of 2019. I already did my income tax and I can show you I certainly didn't make $200,000. They will most likely adjust it. You just got to go through the forms and then they will evaluate it and you might have to go into the office or they'll call you on the phone. But there is an opportunity to revisit it if that's your condition.
Okay, thank you.
You're welcome. Anything else?
Do you want to go over the HSA a little bit more on when to stop if they're planning on
Sure. Okay,
working
so
or not?
if we have anybody that's not on Medicare and maybe they're still working, it goes like this. And again, it might be a little more unique, so I won't spend a whole lot of time, but it works this way. If you're on an HSA and you're still working and you plan to continue working beyond the age of 65, my advice to you is to do nothing, not to sign up for Part A, not to sign up for Part B. Now, some people would tell you, oh, why don't you sign up for Part A? It's a zero premium. And I would tell you that's a big mistake because you can't contribute to your HSA any longer. You've just negated your ability to contribute. But what you have to remember is that you have to almost think about when am I gonna retire or leave, because you have to stop contributing to the HSA 6 months prior to you wanting your Part B. So let's use our example. We're turning 65. I'm not ready to call it quits. I got a group plan and I'm contributing to an HSA. Do nothing. There'll be no penalty. If there's 20 or more employees, that's one of the factors here in doing nothing. So let me back up and say this and caveat it. If you work for an employer and you're continuing to work beyond age 65 and there's less than 20 employees, you do have to do something. And you do have to sign up for Part A and Part B. But if you work for an employer with 20 or more employees and have an HSA and plan to continue to work, don't do anything to sign up and enroll in Medicare. And then 6 months before you want your Part B to start, you have to stop contributing because the government's going to look 6 months back. So now you're age 70. You have to stop 6 months prior to that. All those other HSA dollars, that's good, great, everything's good. But the government would otherwise penalize you for not getting out 6 months prior to you wanting your effective date when you're age 70, which could be, I don't know what age you are today, but so just back into it, 6 months, stop the HSA beyond the age of 65.
To that question, Nancy, then, to anchor off that question, what if I front-loaded my HSA?
You can do that. Yep, absolutely. Great question. Good answer. That is exactly what people do. They will front-load it and then stop it.
Yeah.
Yep. And I think the penalty is minor. Some people have also said, I'll take the penalty. I'm still better off letting my employer contribute to my HSA. I'm still ahead when I do the math and I try to figure out the penalty. So it's on an individual basis. Sometimes that's even a good question for the CPA or the accountant. But I've had people do everything that you've just described, plus what I described, which was I just stayed. I contributed. What my employer gave me offset my little penalty. I'm fine. I'm good to go.
So it really goes to show that each situation is unique and has to be evaluated to determine what the best outcomes are.
Very true. Yes.
And just to confirm or reiterate, if I want to spend an hour with you or 3 hours with you, there's no charge.
That is correct. There is no charge. I'm not allowed to ever charge, because I'm compensated by the insurance company. If you decide you'd like me to be your agent and represent you, then I will do the paperwork to get you all enrolled, and I would be your go-to person who makes contact with you. But that's correct. That's how I get compensated. And I would just ask, if you have an agent and you like that agent and you're not hearing from that agent, you really should tap them on the shoulder, because they are getting a commission every year. And it really is my belief that they owe you that they should be responsible for contacting you at a minimum once a year and offering you a review, and that's what we do. So.
And to, again, anchor off that a little bit, it seems so confusing to try, and it would be maddening, I'm sure, to try and figure out all these different plans if you were to do it by yourself, which is why it's really important to have someone like you to be able to say, these are all my situation, and this is then you provide the different options. Or
Exactly. So you don't want to go it alone. And in preparation for the appointment, we're going to ask you who your doctors are. We're going to ask you what your medications are. We're going to ask you what pharmacy that you go to. And that way we can find the appropriate carrier based on, do you travel? That's another factor. People that have places in Florida or Arizona or California, and they live there 4 or 5 months of the year, and they might even have a doctor there now that they see. They might be better suited to a Medigap. Or if they stay with the Medicare Advantage Plan, they need to know how it's going to work if they need to see a doctor outside the network. So we know the little nuances. We ask a ton of questions so that we can design the best plan based on that person's needs and travel and scripts and all that. Yes. Yep.
Well, I want to thank you so much, Nancy, for sharing your expertise today and providing all of us with some fantastic information.
Well, you're so welcome. I encourage anyone that has any questions of any sort to let us know. Be happy to help, and love that technology. So I thank you for hanging in there with me.
I'm going to talk to you just a second.
Thank you.
Okay, thank you.
All right.